So number one is, does the patient need someone to stay with them for now?
Right.
So explain that.
You always want to ask, what kind of care, do they need 24-hour care?
Okay.
Are they not safe to be by themselves at any point in time when they're home? Can they be left alone a few hours at a time? So you kind of want to know what the recommendation is as far as, do they need somebody there to stay with them? Because I've had people that have had like total joint surgeries. Some of them are planning on going home alone, which is kind of rough. So you do definitely want to ask that question.
Question number two is, does the patient need someone to assist them when they are up in their walker, on their walker, or maybe in a wheelchair?
Right.
Some kind of mobility device.
Yeah. So a lot of times, there's varying degrees to how much assistance somebody may need when they're up, due to safety.
Yeah.
And sometimes there are people that may come out of the hospital or rehab, and they're okay to walk on their own with their walker. They're safe. They're not a high fall risk as long as they have their walker. Sometimes people may need what we call standby assistance or contact guard assistance, meaning they need somebody right there. Contact guard, they need somebody touching them, preferably with a gait belt, so that they have a hand on them in case they lose their balance. So it's good to know how much assistance. Some people may be coming home. I hope not. But some people may be coming home needing assistance getting up out of a chair. And how much assistance is that going to be? Am I going to, as the caregiver, need to give them a little bit of assistance? Middle of the road, 50% assistance, or are they going to need a lot of help?
And chances are they've been working with a therapist, whether it's in the hospital or at a rehab facility, obviously, or a nursing home.
Right.
So probably checking with the therapist directly would probably be the best, you get the best answer, the most precise answer from the therapist.